I'm Stephen Smith, I'm a GP here at the Windrush Medical Practice. This project came together around the need from a commissioning point of view to develop new services. On the ground floor, we've got specialist podiatry. They've got a special machine analysing people's gait and walking. There is the endoscopy facility. And on the first floor is the main area for our surgery. We've developed other parts to the waiting room as well for patient comfort. So there is a baby feeding room, and there's a baby changing room, and we've also got a small area that will be set up as a patient library, and also plan to have IT access there as well. When people walk in immediately, they need to be guided to the relevant facility. We've got the system that people are familiar with a check-in screen, and when we call them, the name comes up on the TV screen. We've got lots of GP consulting rooms and also nursing consulting rooms, because that's been one of the areas that things have really developed in the last few years, is the use of nurses and healthcare assistants to take on specific tasks and clinics, which has been very important to us. We offer a minor illness clinic, which is not a common thing, but basically for people who feel they need to be seen on the day, there's a nurse-run clinic in the morning and the afternoon. And we've also developed our dispensary to a greater degree, which is a particular advantage for patients to whom we can dispense to, because they can see us and then pick up their medication straight away. On the second floor, we've got room for expansion. We've got about 13,000 patients. It's anticipated we could go up to about 18,000, which mirrors the projected rise of the population in the area. But also we've got 2 conference facilities. We've got the ISIS room, which will be a general meeting room. For example, the stroke club meet on a weekly basis, and they'll be able to use that room to meet. It's also been kitted out as an IT training suite, and also we train medical students, and so often we'll have quite a few medical students in a room with a patient. Some of those are to house the requirements for GPs in training, and they need slightly larger rooms so that their consultations can be videoed. We've also got another conference suite, which we've named the Thames, and this is a bigger area that can be used for obviously larger scale meetings. It's a lovely building, it's a lovely place to work in, but also from a patient's perspective, it's a nice building to come to. It's more light and airy, and that was part of the brief, was to get as much natural light as we could. One of the benefits of our location is that we're co-located with the Whitney Community Hospital, and that too provides services for the wider community. We've teamed up with the Oxfordshire Health System, and so it will allow us better communication both to and from the hospital, because we're sharing the same network. Whitney is a lovely market town on the east end of the Cotswolds. Population's now about 40,000, I believe. And there's a real sort of vibe and a buzz about Whitney. Again, we like to feel we're a family practice, but there's that similar feel in Whitney, where with lots of generations of families, and that adds to the sort of the feel of the place and the surgery as well. We've got a very committed team, loyal team, particularly our admin team and reception team are very stable, and they know a lot of people, they know the area, and they really do work their best to do the best they can in terms of getting the patients through to see us in the right way. Our patient group, who've been incredibly helpful in terms of getting this up and running, we involved them in the design stages, showed them some of the sample boards and logos and things like that to get their sort of input. We're very keen not to lose the family GP feel that we've always had here at the Windrush. We really do value that sort of continuity that we have with patients and their families, and although we'll get bigger and things will change, that's such an inherent characteristic of something that we're so keen to keep going that we won't lose that.